talks then by our esteemed speakers. Professor S. Natarajan, it's my privilege and honor to introduce him. He's a Padma Shri awardee with over 35 years of experience in ophthalmology. He specializes in vitreous and retinal surgeries and performed in number of surgeries, and he's also a teacher, great teacher, and has trained 68 plus vitreoretinal surgeons, and he's a prolific speaker and has given multiple lectures. He's focused on blindness prevention and advancing vitreoretinal surgery across India and across the globe. Next, we have with us Professor Calvin Pang, who is a senior professor at the Visual Sciences at CUHK and the director of the Shanto International Center. And he's a leader in ophthalmology and visual sciences. He's known for his work in molecular genetics of eye diseases, ocular pharmacokinetics, and myopia prevention. He is also an excellent teacher, delivered over 200 invited lectures worldwide. He has several awards and recognitions, especially the Technology Progress Awards, the APAO Senior Achievement Award, and is also the honorary fellow of the College of Ophthalmologists of Hong Kong. He has over 600 publications on molecular genomics and eye disease models, and also on the impact of COVID-19 on ophthalmic health. Professor Namrata Sharma, we all know, and no need for an introduction for her. Next, we have Dr. Janie Wiggs, Paul Austin. She's the Paul Austin Chandler Professor in Ophthalmology at the Harvard Medical School. She's an expert in medical genetics, especially glaucoma. We have all grown, reading her articles and publications on glaucoma genetics. She has a Lifetime Achievement Award and Mentoring Award from the Harvard Ophthalmology. She also got the Teacher of the Year Award for the Harvard Ophthalmology residents. She has helped mentees secure NIH funding, mentored numerous future ophthalmology leaders, and we are so fortunate to have her on our panel today. And next, we have Dr. Gerald Schultz, who is a surgeon at the Eisenhower Medical Center. He's also the chief of ophthalmology at the Desert Regional Medical Center and associate professor at the Loma Linda University. His focus is on ophthalmic genetics and anterior segment surgery. He has lectured at the AIOS, and he has a special affinity for India, and thank you for that, and teaching us always, periodically coming to India and teaching us. He has gold medal from the Bombay Ophthalmic Association. Professor Anne Slavatinek unfortunately could not join us personally, but she has sent across a recorded talk. She is the Director of Division of Human Genetics at the and Professor of Pediatrics at the University of Cincinnati Hospital, and her focus is on dysmorphology and medical genetics, and especially she specializes in the developmental eye defects and multiple congenital anomaly syndromes. She aims to uncover the genetic causes of disorders to improve the diagnosis and treatment. Her pioneering works in pediatric genetics and advancing the genetic disorders and the clinical management. We have with us Dr. Vinay Gupta, who is a distinguished professor at the Glaucoma Services Department at RP Center, AIIMS. And he completed his glaucoma fellowship at the Royal Victoria Eye and Ear Hospital, Melbourne, and holds an MBA from the Delhi University. He specializes in congenital, juvenile, surgical glaucomas and glaucoma genetics, authors 220 plus index publications. He is the associate editor for the Indian Journal of Ophthalmology, on the editorial board of AJ Case Reports and Eye. He's also the founding president of the Indian Pediatric Glaucoma Society, and numerous awards to his name, and the recent Indo-US collaborative grant also. And I think Dr. Natarajan has already introduced me, so that is where I'll end with all my introductions and invite Dr. Calvin Pang for his talk.
By the time Dr. Calvin Pang getting his slides.
That side or this side? His talk. Dr. Pang. Which side? Sir.
This side?
Which side? Here. This side.
You have to go there.
He's calling you.
Right, thanks very much. Thank you very much, Soja. I'm sorry, I have to give the first talk and then I have to rush because of another meeting, so I couldn't stay and hear the other speakers. I'm sorry about that. Now, I was asked by Soja, she's in charge of this meeting, to talk something on myopia. Right? But yesterday, my colleague, Professor Gai Chen, in a genetic meeting, had shared some of our data already on myopia genetics, right? But then I'll mention some, and also I'll go back to the beginning, how we organize this cohort for our genetic studies on myopia. And then lovely to have you around so that, hopefully we could have the opportunities for collaboration. Right? So myopia, very, very high prevalence in the world, right? We all know that. And in Hong Kong, extremely high. Unfortunately, we are among the top, if not the top city in the world that has the highest prevalence of myopia across all ages in Hong Kong. So we have good reason to study myopia. So that's how we organize our myopia study. We give ourselves a task on myopia prevention at childhood. So we start our work in this particular work. We do more on childhood myopia than elders, but also, of course, we have to do elders. But still, for the childhood myopia, that's our major attention. We organize ourselves in 3 studies. One is the big one, that is the Hong Kong Children Eye Study. It's a territory-wide across all districts of the whole of Hong Kong, which is a city in itself. The parent, children, and their parents, so family, children, and parents together. We study the risk factors, lifestyle, parental style, and mental health, public education, together with community service. So it's involved in a big territorial study since 2015. I'll come back to that later. And out of this study, we set aside the Hong Kong Children Eye Genetic Studies to establish the biobanks for children and their parents, right? So for this, we conducted GWAS and whole exome sequencing materials, genotyping myopia genes. So this is for genetics, the Hong Kong Children Eye Genetic Study, which is part of the Hong Kong Children Eye Study. But then these are children, families that we have children and parents with complete ophthalmic data. And out of this, we also organized the low concentration atropine for myopia progression study, so-called the LAM study, that we utilized 0.05%, 0.05%, beg pardon, of atropine, low concentration, and then we have conducted randomized controlled trial and with placebo for this atropine study. But we also have a genetic dimension in this study. So the study cohorts, how we organize it, we have so-called patients and controls, right? However, it's still the whole of Hong Kong. We recruit without any selection people that could come to us as a territory-wide population study. Recruitment study subjects were patients and controls, but then the patients are from the children, controls also from these children, and then we do association studies, we do examinations. Now, for some patients, we would have complete imaging examinations. Some, for example, the thyroid eye disease patient, we have endocrinology. But all in all, we have general demographic information, complete ophthalmic investigations, and then we collect all the necessary data. So that's the study itself. We started in 2015 up to today, it's still going on, at the CHK Eye Center based in the Hong Kong Eye Hospital. And we haven't reached 50,000 yet. It's 48,000 something, right? It's going on. Our aim is to complete over 50,000 families. That means we have at least 50,000 trials, i.e. a child. No, not necessarily 50,000 trials, right? That we may aim at that, but then of course, we have parents that are also myopic, so we can't form trials on that. So that's a bit of a misnomer. But still, we will have 50,000 children between 8 to 10 years old, and actually now we have expanded it to 3 years old. And both of their parents, so we all have their parents together. It's territory-wide among all the districts in Hong Kong. So on every Saturday from 9 a.m. to 6 p.m., we could invite 100 families, right, each Saturday to come into our eye center and to do complete ophthalmic investigation. We take blood and things like that. And since 2022, we extend our study to 3 to 6 years old children, and also special education need children and ethnic minorities. So we do that. And so they, instead of going out to recruit them, we invited them in so that they will have complete ophthalmic investigations in the clinic, right, as if they were patients. And of course, we collect blood from children and parents. And also we collect buccal swab if we can't take blood, but essentially we take blood for DNA. And we also work on the conjunctival swab for ocular microbiome, which is another study. So for the lifestyle, we give out detailed questionnaires before they came. I emailed them or by text. And then they came back. Then all these questionnaires, fill in the details, 350 questions are all assistive. So we train medical students to go through the questionnaires with the parent to standardize the information, right? So we do that, and also it's part of education to the parents. So we do that. So each family will spend about 45 minutes, a face-to-face interview, and complete these questionnaires while they are with us, while the child and the parents receive ophthalmic investigation. That's what we do. And in the meantime, because we need to have people coming in, so we have strong community, or what I would say heavy community engagement in the TV, and then public education. We go to the mall. Go to the malls, we still do that, and also we go out, and then it's more on publicity, right? That's what we do all over the city of Hong Kong. So that's what we've been doing. Even today, we're still continuing until we reach the goal of over 50,000, right? So on the genetic part, so colloquially, we'll say it's genomics or scientifically, or refractive error in general, myopia based on spherical equivalent and axial length, cycloplegic refractive errors, and then endophenotype, and also we also follow this every 3 years. So it's also myopic progression, right? And also part of it, we do the atropine treatment response. I always have to mention, we always mention this first paper that we published. This is actually 2055 trials, right? But then, of course, we have other families. I think this is not trials because some parents are myopic, so it is wrong. It should be 2055 families, right? Parental myopia. So we can see that very clearly that there's a dosage effect, right? So when both parents are highly myopic, the children have a high likelihood of myopia. So